Hello. Today we want to talk about the association between gum disease and chronic disease. You might think this is a little bit random and that anything that happens in your mouth, it doesn't have very much to do with what could happen in your brain or your heart or your lungs. But actually, we're about to learn what is the association, what's the real thing here. So, if you feel a little bit confused and you want to know how is it possible that any disease in your mouth can lead to any problem in your overall health, stay until the end and hear more about this podcast designed to let you know everything regarding this topic. We're going to start by talking about the gum diseases or periodontal diseases. This is a process that results mainly from inflammation or infection of the gums and bone that surround and support the teeth. Here we have a very healthy tooth, and we can see these gums look very healthy, and the support of the bone here, it's all complete, all strong, and this is a very pretty, clean, white tooth. But in contrast, we have gingivitis here, and we can see an accumulation of dental plaque, and there are some swollen gums here. Those look red and about to bleed. So those are the signs of gingivitis. But these can come to a worse scenario once you forget to remove the dental plaque or attend to your regular dental checkups. Well, this can go to even a worse thing. Here is what we call periodontitis, and it's just the result of losing bone because the infection has caused so much damage to the supportive tissue, to the soft tissue. It came to the bone. Now it's really bad because it can lead to loss of tooth, or it can lead to lose your teeth with the time. This is a very common situation in the adult population. We can see here 47.2 of adults aged 30 years and older have some form of periodontal disease, or it's translated to bone loss, any inflammation in the gums. Also, periodontal disease increases with age. That means that with the time, if we don't take care properly of our gums and our teeth, this disease, gum disease, will more likely appear over the time. Okay, now there are some signs to know that you might have any gum disease. And here are bad breath or bad taste that won't go away easily, red or swollen gums that we already talked about it, tender or bleeding gums, painful chewing, loose teeth, sensitive teeth, gums that have pulled away from your teeth, any change in the way your teeth fit together when you bite, any change in the fit of partial dentures. And here we see it again. The inflammatory process increases with age. The periodontal disease is an inflammatory disease. And that's very important because we can, for example, check the cycle and the associations that gum disease has with diabetes. And we can see that those can really impact the overall health. Here we have the gum disease, and then there is chronic inflammation over the time after a long period. Then this leads to more complications in diabetes, and it's also associated and a risk factor to have elevated blood sugar levels that will lead to other diseases, chronic diseases. Here we have some of them. It can increase the risk of stroke. It can increase the risk of suffering cardiovascular diseases. It can increase the risk of chronic kidney disease, worsen blood sugar control, and adversely affects diabetes control and complications, as you can read it here. Again, the best way to combat all bacteria and all the complications that come with any chronic disease, like periodontitis, gingivitis, are avoid these risk factors. So, smoking, diabetes, poor oral hygiene, stress, heredity, all of these are risk factors that if you know you have any of these habits or diseases, more likely you want to visit your dentist regularly, more frequently than other people that don't have the risk factors. Here are the recommendations for you. See a dentist at least once a year for checkups. Brush and floss every day to remove the bacteria that cause gum disease. So, commercials actually don't lie when they say you need to floss every day and brush your teeth. These haven't changed and is the most effective way to prevent and control any gum disease. Thank you for watching. If you want to learn more regarding all the topics that we have discussed today, you can find us on Facebook. You can like us on the Smiles Heart campaign page. You can also find us on Instagram, or you can give us a call and let us know more about you. Remember that we are Smiles from the Bottom of the Heart campaign, and here we are to resolve any of your questions. Thanks again for watching.